Hello, it's Dr. Robbie White, Chief Clinical Officer for Ergo-Flex Technologies, and I want to talk to you about just how powerful the total rate of body O2 is. It provides oxygen perfusion for the body, which allows cellular repair to occur. Now, there's several different things that we need to do for our neuropathy patients who are suffering with these problems. Number one, we got to create an anti-inflammatory state. Okay. In order for that to occur, we have to get the swelling down in the tissues around the area where they're having trouble. So if it's in the feet, we got to make sure that their lymphatics are actually working better. And we also need to make sure that the blood supply is working the way it should. One of the key elements of neuropathy is the blood supply is absolutely shot. So angiogenesis and lymphatic drainage are absolutely key. Now, you have to use oxygen to rebuild those tissues. You have to use oxygen to rebuild all the tissues, okay? But if you can't get blood supply to the tissue's going to die. That's essentially what's happening with the tissue. The tissue is not working aerobically, which means oxygen dependent. It's working anaerobically, which is deoxygenated. It's actually using fermentation to create ATP, and that's how the tissue is actually surviving. That's why when you take a look at neuropathy patients' feet, it looks horrible. Pitting edema, no wonder they can't feel hot or cold. There's some very specific reasons why those nerve fibers, those small diameter afferent nerve fibers, are in trouble. It's because you're not getting enough blood supply to them, which means they're not working with oxygen, which means they're working in an anaerobic state. Key. Have to get oxygen perfused into the tissue so we can get that moving better. So angiogenesis is an absolute factor in what you need to do for your patients with neuropathy.